India has introduced new COVID-19 guidelines, giving state governments more power to impose local curfews and restrictions. The changes come despite a slowdown in cases. Infections in November were at their lowest level in 4 months. Neha Punia reports.
For more than 24 days now, India has recorded fewer than 50,000 COVID-19 infections on a daily basis. But despite this slowing down in the infection rate, the Indian government is extending its lockdown measures. Starting today, states will have the power to impose limited restrictions to curb mobility instead of shutting down an entire region or even the entire country. State governments can now impose night curfews, something states like Punjab, Uttar Pradesh, Haryana and Gujarat have already done. Governments can't seal state borders or impose local lockdowns without the permission of the central government. They can, however, tighten movement restrictions further in containment zones. These are areas with several active COVID-19 cases. The government's encouraging local officials to carry out house-to-house surveillance and run awareness programs in these areas to ensure mask and safe distancing compliance. Experts say this is a good move, but the government needs to do more.
I think we need to prevent super spreader events, absolutely, because whether in the night time or even during the daytime when the super spreader events occur because of religious, political or social reasons, we ought to prevent that. Because we know that when people gather in large numbers, especially indoor but even outdoor, and these crowds are static for some time, the virus tends to gather in clouds and then spread from person to person with greater ease.
Even though the number of infections dropped by more than 30% in November, the extension comes even as there are some regions that are now seeing a resurgence. Some states like Delhi, Maharashtra, Uttar Pradesh are seeing cases rise again. These regions were some of the worst hit when the pandemic first started, and the Indian Prime Minister has also repeatedly stressed that while the overall situation in India is improving, it's not time yet to let our guard down.
जब कोरोना से रिकवरी का रेट बढ़ा तो लोगों को लगता है कि ये वायरस नुकसान नहीं कर रहा है, ये कमजोर हो गया है। बहुत से लोग ये भी सोचने लगे हैं कि अगर बीमार हो भी गए तो ठीक हो जाएंगे। इस वजह से लापरवाही का ये स्टेज बहुत बड़ा व्यापक हो गया है।
Experts say winter poses a big challenge for India. In regions like New Delhi, we're already seeing a spike in cases because of the drop in temperatures and a surge in pollution levels. The local government says it will likely impose some restrictions soon, either in the form of a weekend curfew or nighttime restrictions. The worry in India is that another big surge in infections will add pressure to an already stretched healthcare setup that's seen no let-up since the pandemic started in March. Neha Punia, CNA, New Delhi.